Welcome, fellow Lions fans. I'm Jimmy Liao. This is the Detroit Lions Morning Rounds. Lots of really interesting injury news the past 24 hours or so we'll get into that. First of all, I want to congratulate Chris Spielman for getting a front office job with the Lions. I grew up watching this guy. He's always been a positive energy influence on the team, real tough guy. Post-career, I've loved listening to him on the broadcast on Fox. So I'm going to miss hearing him on those broadcasts, but it's really nice to see a former Lion become a positive influence on the team going forward. All right, so Frank Ragnow, yesterday, Wednesday, initially reported to have a throat fracture, which is something I've never heard of. Well, later in the day, there were reports that it was likely a vocal cord contusion, which is a little bit more specific thing. That makes a little bit more sense to me. Now, I reviewed the entire first half of the game. I did not see anything noticeable or obvious. On many of those blocks in the first quarter, he did engage the defender. The defender had his hands higher up in the upper chest, neck area. Maybe something occurred then. On none of the plays did he afterwards reach for his neck or show any signs of discomfort. It's possible that any kind of injury to the vocal cord could have happened pregame also, and then gradually as the game started got inflamed and got worse. So nothing obvious on video there. Ragnow probably had a fiber optic laryngoscopy from an ENT specialist to take a good look into his vocal cords to see if there was any significant issue. Now, I have a picture on the YouTube channel of this. I actually did a few of these during my residency training. So what you do is you stick a rubbery camera tube. It's a pretty thin tube. Stick it straight into the nose, and then it curves and snakes down straight into the back of your throat, allowing you to visualize the vocal cords. And you thought the COVID test was bad. Well, this camera allows you to really take a good look to see if there's any significant issue. Well, the reports are that there was no eating or breathing issue, and it's an isolated vocal cord contusion. So hopefully that's the case, because vocal cords can cause problems sometimes. It can cause a breathing issue. It can cause shortness of breath. There is actually a disorder called vocal cord dysfunction, where the vocal cords inappropriately close up, causing trouble breathing, wheezing, and it can mimic asthma. So it's really great news that there is no problem with his breathing. So assuming this is an isolated vocal cord issue with no effect on breathing, well, I definitely don't think he's going to be singing the national anthem, but there's a good chance he could play this Sunday in the game. All right, next up, let's talk about DeAndre Swift, who had headaches for 2 or 3 weeks, and yesterday he stated that he did not know if he actually had a concussion. Well, the differential diagnosis of a headache is very long, and a concussion, a post-concussion symptom is one of them, but it can also include things like aneurysm, tumor, intracranial hemorrhage, infection such as meningitis, carbon monoxide poisoning, glaucoma, etc. So he probably had a bunch of blood work, some kind of brain imaging, CT, MRI, MRA, and I assume all those tests came back negative. So once all those tests come back negative for any kind of urgent or emergent issue, it becomes very difficult and oftentimes impossible to figure out the cause of a headache. And this is something I stated in previous episodes. A migraine is a possibility, tension headaches, cluster headaches, sinusitis, etc. So it comes down to circumstantial evidence and history of present illness. If DeAndre Swift has had a history of similar headaches, then it does make a concussion less likely. Also, if there was no obvious acute incident of head trauma, it makes concussion less likely, but we may never know for sure. Hopefully, this does not become a recurring headache issue in the future. We've seen some players have that in the NFL in the past. Percy Harvin, Joe Mixon. These things can be debilitating to players. It can affect your vision. It can affect everything, affect your ability to even function. All right, so Halapoulivaati Vaitai returned to practice on the 16th yesterday. Good news, he's had a left foot problem all year, recurrent issue. Hopefully that can heal up and get right, because he has not played well for us this year, likely due to that foot issue. All right, I want to swing back around to Matthew Stafford's rib issue. Now, it's been confirmed by Jeremy Fowler on ESPN that he likely had a rib cartilage injury. Also on Monday, the x-rays reported to be negative, and that's overall great news. Not necessarily because you're trying to rule out a simple, uncomplicated rib fracture, which quarterbacks can play through without too much problem. For example, we saw Drew Brees play through that earlier in the year. We never even knew about it until he ended up having further fractures. So an uncomplicated rib fracture, we as fans probably never hear about, and quarterbacks play through all the time. The x-ray is important to rule out a pneumothorax or multiple fractures causing a complication, such as difficulty breathing or a flail chest, which is where part of the rib cage is not connected to the rest of the rib cage. So good news that the x-ray was negative. That likely means no fracture, likely a rib cartilage injury. Now, in my video review, I thought that it was likely a torsion type sprain and unlikely to be a blunt trauma injury. However, there's something I missed on the video. So I'm going to run that here. Let me know if you can see it. So here he is getting rolled over from his right side. He does have that twisting, torquing motion. And I didn't think at first that he had any blunt trauma. However, I feel like I missed something here. I'll run it again, see if you notice it. All right, so here's what I think I missed. He's holding the ball in his left hand right there. Now remember, his injury is to the left side of his rib cage, upper abdomen. So as you see, when he lands, he rolls over, and it's possible he lands on the ball right there. That could have caused a rib contusion. It could have also caused a rib sprain, as if a ball is just moving and stretching out the rib cage, that could cause a rib sprain. So I think there potentially could have been some blunt trauma that caused all this. Now, this doesn't really change the timeline for Stafford, although in most cases I'd rather have a contusion than a sprain. Now, here's a pop quiz for you Lions fans. Another player of the Lions had a very similar looking injury earlier this year and ended up missing 2 games due to it. Do you know who that is? Well, here's the video of him. It's Jamal Agnew. All right, this is in the Colts game. I'll run this at full speed. So there he is. And it looks like he's also holding the ball in his left hand, and he falls onto that ball as well. After the play, he gets up fine, not in any significant discomfort, and I'll run this. But afterwards, a few seconds later, he's reaching up to his left chest rib area. So he likely also had some kind of rib injury, a rib contusion, possible rib fracture, or a rib cartilage sprain like Stafford. So he had to miss 2 games. Is Stafford going to miss 2 games? Hard to say. It really comes down to a pain issue. Now, Dr. David Chow, a former San Diego Chargers team doctor, many of you guys know him and follow him. He states that a rib cartilage issue can be very painful, oftentimes more painful than a rib fracture. And he tweeted that a rib block may be considered pre-game to help take away the pain and allow Stafford to play. Now, we saw this earlier this year where there was a complication that occurred with a rib block. You guys remember who that is? Tyrod Taylor. He got a rib block for a rib fracture issue, ended up having a pneumothorax due to that. That's a very unlikely thing that's going to happen, but these kind of rib blocks are very common to occur for players. All right, so going forward, what are the chances for Stafford this coming Sunday? Well, from the practice reports, he will definitely not have a full practice this week, both because of his thumb injury, which he's still healing from. He hasn't had a full practice since he hurt his thumb. And because of this rib issue, he just needs rest. He needs to avoid aggravating the issue and giving this a chance to heal as much as possible. Hopefully, we can see him get up to a LP by Friday, which would be a very good sign that he may play on Sunday. If he's an NP this whole week, I think there's still a chance he could play, because this might end up being a game time decision where he gets a rib block, maybe gets a pain shot like a Toradol shot, and then he goes out and sees what he can do. In order for NFL players to play, 3 parties have to all give the okay. First is the doctor, second is player, third is coaches. Well, the doctors likely are going to give Stafford the okay to play, because this is more of a pain limitation issue than a structural issue that could cause significant issues or get a lot worse. So with Stafford and Bevell, it really comes down to, can he throw the ball properly or not? Can he throw the ball effectively? Now, we know Stafford's tough, and he wants to play. The past 2 games, he's had the best 2 games probably of the entire season. So he wants to play. I'm sure Bevell wants Stafford to play at a high level, because he's coaching for his career these last 5 games. The offense has looked significantly different the past 2 games. A much more pass-centric offense, a lot more play action, a lot more taking shots down the field. The offense has looked really good. Now, there's no chance that Bevell's going to become the head coach of the Lions after the season, but there's a very real possibility he could be retained as the offensive coordinator if the offense continues to look potent these last 3 games, and if the Lions end up hiring a defensive head coach like Robert Saleh. So Bevell has a strong interest in keeping this offense humming. Hopefully Stafford can play at a high level. Hopefully he can throw the ball properly. So we'll have to see about that. Now, bear in mind, as Lions fans, there's a reason we might want to have Bevell be the offensive coordinator going into next year. That's because COVID is very likely going to still be an issue in 2021. There likely won't be any off-season practices, meaning no OTAs, no minicamps. That means after the season, the first time players are going to be practicing together is going to be in training camp again. And because there's no off-season workouts, there will likely be another acclimation period of 15, 20 days or so, just like this year. So the number of practices will be cut. Add that all up, and there's a significant advantage to teams that are able to keep the same offensive system and coaches. So there's a lot riding on these last 3 games for Bevell for sure, and for Matthew Stafford. So it'll be interesting to see how it plays out for the rest of the season. Feel free to leave comments on YouTube or Twitter at Jimmy Liao MD. Thanks.